Good day, good day. I promised my students that we are going to have a short presentation on blood flow from and to the heart. So this is going to be a short one, hence I decided I will just record and not have a class, right? Uh, Before we can get further, remember that when we talk about the heart is situated in the mediastinal cavity, isn't it? And remember, when we talk about the mediastinal cavity, it's in between the lungs. It's in between the lungs, right? And when we say it's in between the lungs, meaning that is the mediastinal section of the thoracic cavity. And remember here that the apex of the heart is the one that faces the left hip, and then the base is directed towards the right shoulder. And when it comes to the coverings of the heart, remember that the heart is enclosed in a sac which is called the pericardium, isn't it? And then after the pericardium, this is where now we have the epicardium, right? The epicardium, and then we have the myocardium. The myocardium is the one that consists of the cardiac muscles. And then the inner layer is the endocardium that lines the heart chambers. Okay. And now coming to the blood flow, which is the order of the day, like I promised you. Okay, yeah. So let's start. We are going to start from the systemic circulation, from the tissue level, from the capillary level, where oxygen is dropped off, and then carbon dioxide it's loaded onto the blood, isn't it? How does it travel? It goes via the superior and inferior vena cava, and it offloads the deoxygenated blood into the right atrium. From the right atrium, when the right atrium is full, we have what we call what? The tricuspid valves. Now the tricuspid valves, they open, and when they open, what happens? The deoxygenated blood is drained onto the right ventricle, right? And remember that for the right ventricles to receive this blood, the right ventricles, they have to be relaxed. Remember that relaxation phase, we call it diastole, or the diastolic phase, right? When the right ventricle is now full, remember when it's full after the diastole, the amount of blood or the volume of blood that we have is called the end diastolic volume. When it's full now, it's going to start, the right ventricle is going to start contracting, which is called what? It's called systole. When it contracts, what's going to happen? It's going to push this pulmonary valve. It forces it open. When it forces it open, blood is going to flow through the pulmonary artery so that it goes to the lungs, where carbon dioxide is released, and then the oxygen is attached to the hemoglobin of the red blood cells, right? Now it means that the blood that we have in the lung level is oxygenated. Now we are going to change the scenario because we are done with the right side of the heart. You must remember one thing. The right side of the heart, it carries deoxygenated blood. The left side of the heart carries oxygenated blood. Now we go. From the lungs, we have oxygenated blood. We go to the pulmonary vein. Please do not be surprised, right? In the heart, the pulmonary artery is the one that transports deoxygenated blood. The pulmonary vein is the one that transports oxygenated blood. Now we're having our oxygenated blood going via the pulmonary vein, and then it offloads this oxygenated blood into the left atrium. When the left atrium is full, we have the mitral valve. It is forced open, and then it offloads onto the left ventricle, right? And remember, for the left ventricle to be able to receive blood, the left ventricle must be relaxed. And remember, like I said before, that relaxation phase is called what? It's called diastole, right? When the left ventricle is full, now, because remember, when the blood is building, there is pressure that is slowly building in the ventricle, isn't it? Now, when the pressure is that high, the mitral valve will be forced open. When it's forced open, it means that this oxygenated blood from the left ventricle is going to travel, passing passing the aortic valve. It travels to the aorta, from the aorta to the arteries, from the arteries to the arterioles, from the arterioles to the capillary level. When now we're on the tissue level, where we were going to offload the oxygen, and then we load the carbon dioxide, and then the system begins again. I hope it's going to be very helpful for you. I hope you understood. I think you know how to get hold of me. If you did not understand, you can repeat again if you understood. If it was not that clear, I'll try another way to make it much more clearer to you. Have a good day. This is the Endlessness Mechanic.